Hi, good morning. My name is Penelope Barrera. I'm going to be your medical assistant today, and I'm going to be showing you how to do a pap smear or assist a doctor in doing a pap smear. So prior to this video, I have assembled all of my supplies, which would include the lubricant, the speculum, the cervical brush, the spatula, the swab, along with the glass slide, 2 swabs for STD check, a thin prep KOH, a hemocoat, as well as the activator, a urine cup for samples, and then 2 pairs of gloves, one for me, one for my doctor. Since for this video I'm going to be using a dummy, I would call my patient by their last name and their first name. As I'm walking them to the room, I would ask them to confirm their date of birth, the last 4 digits of their social, as well as the spelling of their last name to confirm their identity. Once they are in the room, I'd give them the cup for the urine specimen along with 3 wipes. I would explain to them that each wipe is used individually, one for the left labia, one for the right labia, and then one from the clitoral hood all the way to the back. And then they would open the cup, leave the lid on the sink, get the cup, catch the urine midstream, seal the lid tightly, and bring it back to me. Once they did that and brought me back the cup with urine, I would ask them to undress fully, give them a gown, and ask them to leave the opening towards the front. Since for the purpose of this video we're using a dummy, the dummy won't have the gown on, but you would then ask your patient if they needed any assistance. If not, I would step out of the room and wait for their okay to come back in. As soon as they are back out, I would ask them to lay in supine position, waiting for the doctor to come back in. I would bring out the table, and as soon as the doctor came back in, I would take out the leg stands and make sure the patient is in the bottom position. Prior to this video, I have already washed my hands, and so is my doctor. First, I will put on my gloves. Then I will put on the doctor's. And then assist them as soon as they are ready. First, I would lubricate their fingers, hand them the speculum, grab all of my supplies, then I will be performing a KOH, mixing in the swab with the solution, getting a whiff, nod silently to my doctor if there is a smell, and continuing with the STD check. Have the doctor swab A and B. Then, while the doctor is finishing up that exam, I will put drops on each, make sure none of them are positive. Once that is done, the doctor will continue her exam and do the breast examination for the patient. And while that is happening, I will be separating all of my instruments and tests that I have done. So the lubricant would go in the regular trash. The speculum would be autoclaved. This would go to the lab. KOH would be thrown out. Thin prep thrown out. The activator would be put aside. The Hemocoat would be thrown out into the biohazard bag. The STD check would go for the lab. Then I would individually swab each onto the glass slide. I would remove the glass slide, put it in a bag, and send it to the laboratory and put these in the biohazard bag. Once you have finished that and thrown out all of your supplies, you would ask the patient to redress themselves, and that concludes the video. Thank you so much and have a wonderful day.